What's up, everybody? Just wanted to get some older content out to you that I had filmed last Friday. It was my first rheumatology appointment. I had been waiting about 6 months for this appointment and wanted to shoot some footage. Wasn't able to get a lot because the doctor didn't want me filming in there, but here is the footage I was able to get, and I'll give you a little summary afterwards. Alright, it's Friday, the 14th. I'm here in the doctor's office. It's my first rheumatology appointment since my primary care told me I might have lupus or probably have lupus. So I figured for a nice change of scenery, I would film my intro here in the actual doctor's office while I wait for him. So I'm very curious to see what medications he's going to put me on and what tests he's going to do, what he has to say. So hopefully I can get some neat footage. Otherwise, I'll just do a little summary afterwards. And you better believe I smoked before I got here. That ought to help me relax. Alright, it's pretty no frills in here. Your basic. Got the scale there. Some chairs and whatnot. All this stuff here. The tour, the lovely window. The table where the doctor sits. Yeah. Okay, so I'm doing this summary of my first rheumatology appointment about a week after the appointment. And sorry I didn't get footage or more footage during the appointment, but he did not want footage taken of any of the procedures that he did. Because one of the things he did that was nice was he did a cortisone injection in my left ankle, which my primary care physicians, their facility does not inject ankles. So they had done cortisone shots in both of my knees, which had helped, but they were unable to do my left ankle. So it was nice that this rheumatologist was able to do the injection in my left ankle. That's helped a little bit, not tremendously, but there has been a slight noticeable improvement. And then I was curious about the medications he was going to put me on. He put me on that leflutamine, which I had mentioned in one of my strain reviews I posted before this video, which is also known as Avara, which is a treatment for rheumatoid arthritis. And that was the other thing that was frustrating about this appointment is he didn't really tell me if I was dealing with rheumatoid arthritis or lupus. I had mentioned the blood tests for the inflammatory markers for lupus came back positive. He said, well, since you had rheumatoid arthritis as a child and you were on Enbrel, that can show the inflammatory markers for lupus. And I certainly, just based on the list of symptoms they tell you to look for, I definitely feel like I have more of the symptoms for lupus than rheumatoid arthritis. But they're both autoimmune conditions, so the drugs that work for the rheumatoid arthritis, I'm assuming, would probably work to help the conditions of the lupus as well. So it probably really doesn't matter at this point. But the Avara he's put me on, I've been on it for about a week so far. It seems to be helping, which is good, and the side effects have been minimal, which I'm happy with. And the slight, stomach upset and nausea I have been experiencing, that smoking helps get rid of that, no problem. And dabbing helps as well. So that I'm okay with, even though I was nervous about taking the Avara at first. But he's also trying to do it in combination with Humira, but he didn't start me on that right away because I have to do blood tests because both the flutamine and the Humira are very bad for your liver potentially, and can also cause cancer and stuff like that. So um, I'm hoping that by the next time I see him, the leflutamine by itself will be helping me, and I can try to convince him, hey, let me try doing the minimal amount of drug in my body. Let's try doing just the leflutamine for now and see how that works. Because I really only plan to be on these drugs until I can get my eye surgery to help get my eye inflammation and things like that under control. And if just the Avara helps by itself, it's one pill a day, not too big of a deal, minimal side effects, I wouldn't mind taking that for a longer period of time. But to be on that plus the Humira, which is a injection, you start off with 4, and then you wait 2 weeks, you do 2, and then after that, it's one shot every 2 weeks. Not trying to do all that. Especially because it's something I have to be able to look at, check and see if it's cloudy. I'd rather not need help to take my medications. So hopefully this Avara will work. I'll be able to stay away from the Humira. But either way, I'm hoping that being on these medications will help get my eye pressure and eye inflammation under control so I can hurry and get my cataract surgery, and then I'll be able to see again. I'll be able to read. I'll be able to drive. It'll be awesome. I'll be able to get a job, most importantly. So I'm looking forward to that. But since the last thing I'm going to say is since he won't let me get any video or anything like that, which I feel is my right as a patient, to document what is being done to me and my body, I'm not going to mention the doctor's name or where I go or any of that. I'm not trying to give this place any free publicity, even though there's only like 3 people that watch these videos anyway. But it's just a matter of principle at this point. So hopefully this Avara will work by itself. All in all, not too bad of an experience, and I don't feel bad for hitting that vapor pen in his office. Thanks for watching.